Good evening, all of you. Today we'll continue with the same topic of basic terminology of homeopathic materia medica. So far, we have seen three important terms. Which one? Can anybody tell me the answer? Which three terms we have seen? Anybody can answer. I have not muted anybody. You can unmute yourself. So far, how many basic terminologies of homeopathic materia medica we have seen?
Sir, prover information related to pharmacy and pathogenesis.
Okay, very good, very good. So today we'll see three more important terms. I have not muted anybody. Any technical issue, please let me know immediately. So today we'll see three more terms. That is the sphere of action, therapeutics or clinical, or suited to, and adaptability. So the first, these three terms are very important terms while doing study of any remedy of homeopathic materia medica. So we'll first see the first term, sphere of action. Now let us first understand what is the meaning of this term. The meaning of this term is in front of your screen. You just read it and understand it. So it is, so a specific remedy acts on the different parts of the body, but a remedy prominently acts on which specific part or which system of body. Now most of our remedies acts on most of the parts of the body, but the meaning of prominent is that it affects which part of the body more importantly, and among all the different parts of the body, which part of the body is profoundly affected by this medicine or by this remedy. Now it may be a part, it may be system of body, part like head, eye, nose, or it may be system like gastrointestinal system, respiratory system, central nervous system, autonomic nervous system, etc. And example of this is Noxomica, Podophyllum, Allosocretina. This remedy acts more prominently on GIT. At the same time, it also means remedies prominently acting on which tissues of the body. Now, you have studied the physiology, you have studied the anatomy, so you know what is part, what is system, and what is the tissue. A tissue is a structure which is present in various parts, which is present in the various systems. So muscles is a one part which is present in many of the systems. So sphere of action also means remedy prominently acting on which tissue of the body. Now few examples I have given. Arnica montana is more prominently acting on the muscles and blood vessel. Then ruta grave is a medicine. It acts more prominently on the tendons, where the muscle fibers join together, they form tendon, and where they insert. So they are, arnica action is more prominently seen on the muscles of the body. To be more specific, it is more prominently seen on the skeletal muscles. Then it also acts on the blood capillaries, usually the end part of blood vessels. Then Brownia alba, like medicine, acts on the serous membrane. Now, which are the serous membrane of our body? Can anybody tell me? Serous membranes. I'm waiting for the answer. Can anybody tell me what are the serous membranes present in our body? Okay, no. So usually it is coverings of viscera. Usually it is heart is covered by pericardium, lung is covered by pleura, abdominal organs is covered by serous membrane, peritoneum. So Brownia alba acts prominently on this important serous membranes of body and producing certain pathogenesis and producing certain symptoms. Then how this sphere of action is derived during the study of homeopathic materia medicum, or how the authors of that book have understood this sphere of action. Now, I have detailed here the process. So before going to its process, let me tell you very clearly that it is again indirect information. And if you remember, there are three phases of evolution of materia medica, and usually first phase is what? Drug proving symptoms collection. The second stage of evolution of materia medica is the symptoms will be analyzed, and when the symptoms are analyzed, there emerges the sphere of action. Now, how exactly this process? I have given you a example. Say for example, there are 100 symptoms of a remedy X. It is just a statistical analysis. So then it is further studied that out of this 100 symptoms, 50 symptoms of head, uh, 50 symptoms are related to head, 20 symptoms are related to gastrointestinal tract, 10 symptoms related to face, 5 symptoms related to respiratory system, and 9 symptoms are related to central nervous system, and 6 symptoms are related to back. Now, when this statistical analysis is performed, then we found that the prominent sphere of action of this remedy, the percentage of symptoms which is more plus is on the head and gastrointestinal system, and at the same time it has less prominent action on central nervous system. So this is how the statistical analysis, the indirect statistical analysis of the symptoms will guide us towards identification of important sphere of action of a remedy or prominent sphere of action of a remedy. Then the third phase of this evolution of materia medica is clinical verification. And in this clinical verification, we have already studied the remedy is applied on the basis of totality of symptoms by after taking the proper case analysis, evaluation, then totality of symptom is formed, and so because of clinical verification, so the second phase is analysis of symptoms, then the third phase is clinical verification, and in this clinical verification, the remedies are applied on the basis of totality of symptoms, and retrospective study is done after prescribing this remedy on the basis of totality of symptoms, how many symptoms were relieved, and accordingly the further action further sphere of action is confirmed. For example, now here in the first study, in the second stage, we see that remedy X has more prominent sphere of action on head and gastrointestinal tract and less prominent on the central nervous system. So it is just a statistical analysis. But after clinical experience, after clinical verification, then this remark will come. Remedy X is more useful in clinical practice for complaints of head. So this is the process how this sphere of action is derived after the study of or after the study of homeopathic materia medica, or it is derived during the evolution of homeopathic materia medica of a specific remedy. So this is the process. So from this process, it is very clear that whatever the sphere of actions are mentioned in our books of materia medica, they follow. They are not directly given by the prover, or no prover comes and says to the prover, so please write down, I have felt that this remedy acts more on the head and more on the GIT. No, it is all the indirect information collected after the retrospective analysis of symptoms and the clinical verification. Then, what are the merits and demerits of this specific term? Now, this term is very useful to remember the symptoms. Okay. For example, if I know that the prominent sphere of action is head, so I don't have to remember. So what are the usually symptoms seen in homeopathic remedy on the action of, when the action of remedy is on the head, is usually the various symptoms of headache are more prominently seen. Then some symptoms are related to tumor like growth. Some symptoms are related to scalp. So accordingly, this, once you know the sphere of action, it will help us to remember the symptom. To take one more example of podophyllum and allosaprotina, if they are more acting on the GIT, so what are the symptoms related to gastrointestinal tract? Either there will be burning, which is felt in the chest. There will be symptoms like eructations. There will be symptoms like constipation or diarrhea. Okay, but once you understand that this remedy is acting prominently on the GIT, we don't have to remember these are the 4 important symptoms of this remedy related to gastrointestinal tract. And if it is podophyllum and aloes, we know from the study of homeopathic materia medica, the prominent sphere of action is GIT, and in that prominent sphere of action, these 2 remedies, podophyllum and aloes, produces symptoms like that of diarrhea, while the remedy like nux omega will be acting on the more upper gastrointestinal tract. So what are the symptoms of upper gastrointestinal tract? So, you know, the gastrointestinal tract is divided into upper gastrointestinal tract and lower gastrointestinal tract. So there are certain symptoms of upper GIT, certain symptoms of lower GIT, and we have seen podophyllum aloes acts more prominently on lower gastrointestinal tract, and accordingly we get symptoms of diarrhea, which may be mucoid diarrhea, which may be jelly-like diarrhea, which diarrhea may be very much profuse, watery, etc., etc., etc. But once you know it acts on the lower GIT, it acts and it produces symptom like diarrhea. Okay, this much is sufficient to me to recollect the symptoms of podophyllum, and this will also help you to remember the various symptoms. So the example of nux vomica, so if we know the sphere of action of nux vomica is on the upper GIT. So what are the symptoms of upper GIT, which are usually mentioned in our homeopathic materia medica? It's eructation, burning sensation in the esophagus, burning in the stomach, bitter eructations, indigestion, gases, etc., etc. So once you know that this is the sphere of action, it will help you to remember the symptom. Then it will also aid. Aid means AIDS is not that AIDS. It will help you in the comparative study of two remedies. For example, just now we have compared Naxomica, Podophyllum, and Aloes acting on gastrointestinal tract. But Naxomica has action on the upper GIT. So in case of Naxomica, rather than the symptoms of diarrhea, it will be more sort of for the symptoms like burning in chest, eructations, bitter eructations, indigestion, etc. And it further helps in the final differentiation of remedies. Now, how it helps in the final differentiation of remedy? That there is a one standardized procedure mentioned in the homeopathic literature to find out a remedy for a given case. So usually the first case is taken, then it is analyzed. What are the common symptoms? What are the characteristic symptoms? Then the characteristic symptoms are given more importance. Then totality of symptom is formed, and then the totality of symptom indicates to group of remedy. So if in a case of gastrointestinal tract, we come across, say, the totality of symptom suggests 5 remedies. Example, I'm again repeating, the case is related to gastrointestinal complaint, and the totality is suggesting 5 remedies like Rustox, Ruta, Allosocratina, Naxomica, and say Chelidonia. Okay, the totality corresponds with this 5 remedies. Now, how this sphere of action will come to our help? Both these 5 medicines are equally covering the symptoms. But if we study what is the main organ which is affected in this is gastrointestinal tract. And the remedy, if we study the important sphere of action of these 5 remedies or Rustox, Ruta, Bryonia. We are just now seen Bryonia acts on the serous membrane, Ruta acts on the tendons, Rustox acts on the GIT, so Aloes and Podophyllum acts on the GIT. So just by comparing the disease affected and the sphere of action, you can eliminate in this case 2 remedies, Rustox and Ruta and Bryonia, and now there will be only 2 remedies which will be there, Podophyllum and Aloes. So this is how this sphere of action will help you very much in the final differentiation of remedy also. Then what is the limitation of this term? This sphere of action should not be carried to another extreme, or it should not be carried to the extreme end, because the important reason is it is basically the indirect information. It is not the information collected from the prover. It is just the information. It is just the information gathered or constructed or evolved after retrospective analysis of drug proving. So it has a less value. And again, the method of clinical verification also gives chances of prejudices of various homeopathic physicians. Now, for example, we'll take again the previous example. Rustox, Ruta, Bryonia acts on tendon, joint, and serous membrane, and Podophyllum and Aloes acts more prominently on the GIT. If I too much rely on this information, I will never prescribe remedies like Rustox and Ruta to the GIT cases. So what happens? Even though there are symptoms of gastrointestinal tract related to gastrointestinal tract related to symptoms in Rustox and Ruta, this prejudice will never allow us to prescribe Rustox and Ruta and Bryonia like remedies in the gastrointestinal tract. So this is the limitation. So this term has to be very judiciously, very rationally to be used in study of homeopathic materia medica and its application in the actual practice. Then the next term is therapeutics or clinical. Now, what is this therapeutics or clinical? Now, we already heard about these two words in the various methods of study of homeopathic materia medica. That there is one therapeutic method and there is one clinical method. Now, let us see what does this two term exactly means. So, the dictionary meaning of therapeutics. Now, we have also seen the full name of the homeopathic materia medica is homeopathic materia medica and therapeutics. We know materia medica, it deals with the deals only with the experiment of knowing pathogenetic ability of remedies. So that is materia medica. But what is therapeutics? It is a branch of medical science dealing with use of remedies for disease. And while materia medica, it has nothing to do with this remedy is useful for which disease. It is not the objective of materia medica. The objective is of materia medica and therapeutics is totally different. Materia medica deals with only the pathogenetic ability of a remedy, and therapeutics deals with the actual use of a remedy for various disease condition. And this term is mostly used by the therapeutic method of study of homeopathic materia medica. So in the introductory part of some of the books of homeopathic materia medica, you will see there is a one short heading and they mention this remedy is useful for which diseases. So Arnica montana, my favorite example today or till today. So Arnica montana is more useful for malaria. It is more useful for puerperal sepsis. So this is therapeutics. And then another term is there, clinical. Now the dictionary meaning of clinical means involving direct observations of patients. Again, the term materia medica primarily deals with the healthy individual, and this term clinical, it involves the effect of medicines directly observed on the patient, and this term is most commonly used. This term is most commonly used in the clinical method of study of homeopathic materia medica. Then we will see actually what is the difference between these two terms, therapeutics and clinical. Now both these terms are very loosely used while study of homeopathic materia medica. They are used synonymously. If you want to suggest therapeutics, you may answer the clinical. If you want to answer the clinical, you may suggest therapeutics. So both words are just a synonym for each other. But if we go into the deeper meaning of this term, there will be different. So the term therapeutics is related with the second phase of evolution of homeopathic materia medica. That is the analysis. Now in that analysis, how it will be analyzed, say after taking a review of symptoms. So if there are symptoms are more related with headache, and that headache is only on the one side of head, this headache is associated with nausea, vomiting, and certain blackouts in front of our or in front of the patient's eye. Then this picture, which is mentioned in the materia medica, in that analysis, it will be understood that, oh, this is a very similar to a disease like that of a migraine. So accordingly, in the second phase of evolution of materia medica, the therapeutics is more found out, and it is more prominently, it is a proposed use of remedy. to the disease on the basis of symptom similarity of symptoms of remedy and symptoms of a disease. I hope it is clear. Then it is usually the proposed use of remedies on the basis of symptom similarity of what? Symptom similarity of disease and symptom similarity of symptoms present under specific remedy. So whenever, say for example, there is a analysis of Arnica montana is going on, and in that analysis of Arnica montana they have found that there are certain symptoms which are there are certain symptoms are similar to the some clinic or some diseases, and accordingly they propose Arnica montane as a good use. It may be a good remedy for wounds, for fever, for prostate gland complaints, for purpurial sepsis, for for constipation. So this is therapeutics. And then what is clinical? And I think here it is clinical. And in that clinical, this clinical word just now we have seen it is related with the third phase of evolution of homeopathic materia medica, the direct clinical observation on the patient. And in this phase, what is done? The remedy is administered to a patient, and if that remedy relieves that specific symptom or that specific disease condition, then it is seen or then it is said that yes, this remedy is clinically found very useful in the specific disease. So here example is taken that in the therapeutics, Arnica montanum is used. It is proposed for various kinds of diseases. But after the clinical verification, it has found that Arnica montana is more clinically verified for blunt injury and not only various fevers, but a specific type of fever, that is malarial fever. So this is how there is a difference between therapeutics term and the clinical term. Then what is the merit and demerit of this term? So merit of this term is the same as we have seen of the previous one, but the explanation will be different. It will help us to remember the symptom. If the therapeutics of Arnica suggests that it is more useful for wounds, then there is no need of remembering the symptoms related to the wounds. So what are the symptoms related to the wounds? There is a soreness, lameness, bruised sensation of affected part, and that affected part is very red, it is inflamed, and it is sensitive to the touch. Wounds. So we have just remember the therapeutics, it is useful for wounds, and we can recollect the symptoms of Arnica montana. Then same example we'll take for the clinical. So once it is said that it is a good remedy for, it is a clinically verified remedy for malarial fever. Then what are the symptoms of malarial fever? There is a stage of chill, so first we are taking example of the Arnica malarial fever. So once we know that it is a clinically good remedy for malaria, then we don't have to remember that Arnica montana initially has a stage of chill, then there is a stage of heat, and then there is a stage of sweat. What you will have to remember is the characteristic symptom. So the characteristic symptom of Arnica montana in the fever is that upper part of the body is hot and the lower part of the body is cold. Now, this simple trick will help you to remember the symptoms and plus the characteristic symptoms. Then it further aids in the comparative study. For example, how in the nux vomica, it is a good for symptoms of acid peptic disorder, and the podophyllum is a good remedy for acute gastroenteritis. So once you know that nux vomica is good for acid peptic disorder, there is no need of remembrance of the symptoms of nux vomica. There is a eruption in the upper part of the eruptions, bitter eruptions in the mouth, causing dizziness or causing uncomfort to the patient. There is a bitter erection. The erections are so much bitter, etc., etc., etc. You just have to remember acid peptic disorder. I can, and then you can compare, or you can remember, and further you can also compare with the help of this clinical. So there is no need of remembering the symptoms of podophyllum, like it has diarrhea, profuse diarrhea, polychromatic diarrhea. But we know acute gastroenteritis, we can recollect, and this will also further differentiate the nux vomica and podophyllum. And then again, it helps in the final differentiation of remedy. Again, we'll take the same example. There is a disease related to gastrointestinal tract, and the diagnosis of that disease is acute gastroenteritis. 5 remedies are there, and again, say for example, Rustox, Bryonia, Uta, Aloes, and Podophyllum. So once we know the diagnosis, we know the clinicals of these 5 remedies, you can easily eliminate these remedies like Rustox, Bryonia, and Ruta, and you can focus on the remedies like Podophyllum and Aloes only on the basis of this information. Then again, what is the limitation of this is, again, it is indirect information. It is evolved after the retrospective analysis of drug proving. No patient will directly tell you that this is the clinical, or sorry, no prover will tell you this is the disease from which I have suffered. Dear prover, write it down. So no such type of narration will be given by a prover. It is just an indirect verification, and the clinical verification in steps includes there are a lot of chances of prejudice. So we will end this meeting here.